The Canadian Medical Association endorses the recommendations by the Centre for Urban Health Solutions for an equitable COVID-19 pandemic recovery in Canada. We all know that inequities in our society exist and featured prominently in the way COVID-19 had different impacts across our country. It's time to address these challenges. A 2009 study from the Senate of Canada showed that 50% of a population's health is directly related to socioeconomic factors. In the early phases of the pandemic and since then, we have seen the disproportionate impact COVID-19 has had on low-income and racialized populations across our country. We also know these same communities were disproportionately impacted by pandemic protections that had to be put in place to try to keep all of us safe. Canada's recovery from the pandemic will likely not occur evenly across the country, and there is a real risk that these structural inequalities could be further exacerbated. As a pediatrician working in Canada's North, I witness daily the impact of social determinants of health on our children and on our collective future. Things like poverty, income inequality, racialized violence, gender-based violence, intergenerational trauma, and poverty all impact children and their futures. By adopting these 13 recommendations, we have the opportunity to center equity at the beginning of a new roadmap for health and healthcare for all Canadians. In doing so, we have the opportunity not only to improve health itself, but improve healthcare access and change the trajectory for everyone.